If you have very painful periods, heavy bleeding, or a bulky uterus on scan, it might not be fibroids. Fibroids are not the only cause of these symptoms. It could be adenomyosis. Hello, my name is Chinaza. I am a medical sonographer, and on this space it is everything ultrasound. And in today's video, I will be explaining adenomyosis. Adenomyosis is a condition where the inner lining of the uterus, called the endometrium, starts growing into the muscle layer of the uterus. This causes the uterus to become enlarged, tender, and often painful. Think of the uterus like this. The uterus has three layers: the perimetrium, which is the outer covering or outer layer, the myometrium, which is the middle layer or the uterus muscle, and the endometrium, which is the inner layer of the uterus where periods come from and where implantation takes place. In adenomyosis, the endometrium invades the myometrium, that is, it invades the middle layer or the muscle. This leads to bleeding inside the muscle during periods. This results in pain, inflammation, and an enlarged uterus. The common symptoms include heavy menstrual bleeding, severe menstrual cramp, chronic pelvic pain, pain during intercourse, and an enlarged or bulky uterus, and sometimes infertility. On ultrasound, here are the key features we look out for. When we scan the uterus in someone with adenomyosis, it doesn't look normal, and I'll explain it in a simple way. The uterus appears globular, that is, the uterus looks more rounded and bigger than usual. Instead of having its normal shape, the uterus looks more full and rounded, almost like it is swollen. Another thing we see is asymmetrical thickening of the myometrium, that is, one side of the uterus may look thicker than the other. Normally, the muscle of the uterus should be even all around, but here, one side may look thicker or heavier, like something is going on inside. Another thing we see is heterogeneous myometrial texture, that is, the inside of the muscle doesn't look smooth. Instead of looking neat and uniform, the muscle looks a bit rough or patchy, like it is being disturbed. We may also see dark spots inside the muscle. These are like small pockets of fluid trapped inside the muscle. They show up as little dark areas on the scan. What I am calling the muscle is the middle part of the uterus, that is the myometrium. Another thing we may see is poorly defined endometrial myometrial junction. That is, the boundary between layers between the endometrium and the myometrium becomes unclear. Normally, we can see it clearly when the inner lining ends and where the muscle begins. But in the case of adenomyosis, this line becomes blurred, like it has been smudged or something. Another thing we see, there's a special type of shadow on scan. We may also see a type of shadow spreading out like a fan. It is not something the patient feels, but it helps us recognize the condition on ultrasound. So in simple terms, the uterus looks bigger, uneven, less smooth, and a bit messy inside. And these changes helps us to suspect adenomyosis alongside your symptoms. Transvaginal ultrasound gives better details than transabdominal scan, but they both give the same results. Let us do a quick comparison between fibroids and adenomyosis. Now, a lot of people hear fibroids and assume every uterine problem is fibroids, but adenomyosis is actually different. Fibroids are well-defined solid masses like a lump or a ball growing inside the uterus. When we scan, we can see them clearly. They have clear edges like a ball sitting inside the uterus. In the case of adenomyosis is spread out, not a lump. It is more like the problem is spread out around inside the muscle, so there is no clear shape or boundary. Also, fibroids can change the shape of the uterus because fibroids are like lumps. They can make the uterus look bumpy or irregular depending on where they are. But in adenomyosis, they make the uterus look more evenly bigger. With adenomyosis, instead of bumps, the uterus just looks bigger and fuller overall, almost like it is swollen. Think of it like this. Fibroids are lumps you can point at. Adenomyosis is a change that spreads out throughout the whole muscle. You will not be able to identify it as a single mass. It just makes the uterus bulky. The exact cause of adenomyosis is not fully understood, but possible factors include hormonal influence, previous uterine surgery, childbirth-related changes, inflammation of the uterine lining, that's inflammation of the endometrium, and people that are at risk of adenomyosis are women that are between the age of 30 to 50, women who have had children, and women with history of uterine surgery. The treatment options depends on the symptoms and fertility goals. That if you're trying to conceive later on, they include pain relief, hormonal therapy, but in some severe cases, hysterectomy, which is the removal of the womb. So you should see a doctor and get a scan done if your period is painful and it's affecting your daily life, or if your bleeding is unusual and heavy. Please don't ignore it. A proper scan can help identify the cause. If you found this helpful, follow for more ultrasound explanations that break down complex condition in simple terms. If you have any more questions or confusion, feel free to drop it in the comment section. Don't forget to like, share, and subscribe, and I'll see you in my next video.